All right, as I mentioned yesterday, a spokesman for Northwell Health, New York's largest private healthcare provider, confirmed that it had to, quote, exit some 1,400 employees who refused to get COVID shots. So now the company can boast that its employees are 100% vaccinated. Unfortunately, Northwell Health won't be the last to make that claim as vaccine mandates continue to force Americans to get the jab or lose their job. That includes even those who have natural immunity, which, as I mentioned earlier, scientists at Pfizer admitted in this latest undercover video by Project Veritas is probably better than their vaccine.
You're protected most likely for longer, since it was a natural response.
We're like bred and taught to be like vaccine is safer than actually getting COVID. You cannot talk about this in public. If you have antibodies built up, you should be able to prove that you have those built up.
I mean, I still feel like I work for an evil corporation. They're trying to keep track of everyone that's been vaccinated versus the census of how many people are actually reported. Basically, our organization is run on COVID money now. You don't talk about anything that can possibly implicate you or big pharma.
As surprising as these confessions may be, my first guest will tell you that there is plenty of data out there that makes the case for natural immunity. With me now is Senator Rand Paul of Kentucky, who last week grilled the Secretary of HHS, Secretary Becerra, on the issue of natural immunity during a Senate committee hearing. Senator Paul is a medical doctor who owned his own ophthalmology practice and performed eye surgery for 18 years. Senator, welcome back to the program.
Well, thanks for having me. This shouldn't surprise us. The thing is if you've had basic high school science, you realize that vaccines are actually based on what happens naturally. When you get an infection, you develop an immune response. A vaccine is trying to simulate what you get naturally when you get an immune response from having it. There's really probably not a scientist, including Dr. Fauci out there, that actually will deny it, but they act sort of flummoxed or perplexed because they have an agenda. And Dr. Fauci feels that you aren't smart enough to quite make these decisions. So he has to shade the truth. He has to give you the truth that he thinks you're able to capable of understanding and still do what he thinks you ought to do. And so the thing is the studies are very clear on this. There's a study out of Israel, 2.5 million people. That's a large study. And it shows that if you've had the disease and what are the odds of you getting hospitalized? 7 times less than if you've only been vaccinated. This isn't an argument against being vaccinated. I think people should get vaccinated who are in high-risk groups, voluntarily so. You should try to persuade them. But at the same time, for people who've already had the disease, particularly young people who've had the disease, there really is no evidence that you have to get vaccinated or that the vaccine in any way is better than natural immunity.
So, Senator, let me ask you about that because the Dr. Fauci, Secretary Becerra, none of them want to have a conversation about natural immunity. And we just saw what happened in New York yesterday, the largest healthcare system firing 1,400 employees for not getting vaccinated. And that's just really kind of a picture of what's going to happen across the nation if this mandate goes into effect by the president. Is the Biden administration trying to create a healthcare crisis where we already have a healthcare system that has a shortage of personnel? This will only make matters worse.
One thing's for certain, the Biden administration is not following the science. Those on the left say, oh, they're the followers of science and the rest of us aren't. The science shows that natural immunity works when you've had COVID, that it's as good or better than the vaccine. Think about it this way, too. Hospitals, doctors, nurses, orderlies, everybody working in the hospital risked their life for over a year when there was no vaccine and not very good treatment. They risked their lives to take care of all of us. Many of them got COVID and now have immunity. And how are they paid back by their employer? They're slapped away and said, unless you submit to our will, you can no longer work here, even though it goes against the science. The science does not support what the hospitals are doing here. It shows a callous disregard for their employees. And frankly, hopefully there will be hospitals and opportunities for these people to go somewhere else. There are a few health systems out there that are allowing people to come back to work if they have proof that they'd had the infection previously. But I find this very insulting to both science, but also to these workers who risk their lives to take care of all of us.
So, Senator Paul, what's the solution here? How are we going to address this issue?
You know, I think it's difficult because that in a free country, employers do have rights to make certain rules on employment. So I don't know that the government can forbid them from these rules, but they're making these rules based on faulty advice from government. So one thing you could do to correct this is send Dr. Fauci packing. He disseminates more bad information and misinformation than probably anybody ever has in the history of public health. I'll give you an example. If one of your viewers is 80 years old and they're taking care of their spouse who's about the same age who has COVID, if they go into the room to take care of them and they're wearing a cloth mask, they're greatly increasing their risk of getting the disease from their spouse. If they wear an N95 mask, they have a fighting chance to not get the infection from their spouse. They can also take monoclonal antibodies even if they're not yet infected. Do you hear Fauci telling you any of this? Instead, he spreads the misinformation that all masks are the same and everybody should wear them all the time. But if you tell people to wear a cloth mask, you're telling people to wear what the doctors don't wear, the nurses don't wear them, and you're putting them at risk through misinformation. So it's an upside down world. We have Facebook or YouTube bans me saying that cloth masks don't work, when in reality, if people would listen to me, we could save lives. I've also been saying that monoclonal antibodies can be given to spouses who are not yet infected, and the studies show that you can save lives that way. That's not being told by the government either. So I'm put in the category of spreading misinformation when the reality is Dr. Fauci, who's top of the food chain, is spreading way more misinformation than anybody ever could, and actually lives are being cost. The thing is, he ignores natural immunity. So what's he trying to do? Force the vaccine on younger and younger patients. They've not yet studied whether or not, if you're a 15-year-old and you've had COVID and you give you the vaccine, is there an increased risk for side effects? They haven't studied it because the people who've had COVID are excluded from the studies. So we don't know yet whether if you've had COVID and you're a young person, whether the vaccine might have harm. In general, I'm not arguing against the vaccine. Right. For the most part, I am for it for high-risk people, but everybody should have a choice, and particularly young people. A 85-year-old has a 10,000 times greater chance of dying than a 10-year-old. You think we should force the same thing on both or tell them even the same advice? The advice is way different for an 85-year-old or 75-year-old than it should be a 10-year-old. But this makes common sense, but it's all coming from the top down. The one thing we could do is get rid of Dr. Fauci immediately.
I agree with you on all the above. I'm not against the vaccine, but I think it's a decision that individuals need to make in consultation with their doctors based upon their situation. And I agree with you. I think Dr. Fauci needs to go into retirement. Senator Rand Paul, great to be with you. I wanted to get to Title X funding, a rule that was changed today by the Biden administration, but we're out of time. But it's an issue I know that you care deeply about because you've been fighting to defund Planned Parenthood and protect the unborn. Thanks so much for joining us today.